Hello friends, I am Dr. Dinesh Naik. I am Specialist Pediatrician and Head of Department of Pediatrics at Tumbe Hospital, Fujairah. And today I am going to speak about COVID-19 and its impact on child health. As we know, this coronavirus has affected people from all spheres of life, the rich, the poor, the strong, the weak, the elite and even the common man. Even the children are not being spared. But fortunately, the percentage of children infected, even in the most affected countries, is around 1 to 2%. And most of them are either asymptomatic or have mild symptoms. Commonly, children may present with fever, cold, cough, throat pain, or sometimes even stomach pain or diarrhea and nausea, vomiting. Most of these children can be managed with a little paracetamol, warm fluids, and managed at OPD level and kept at home. Some children may have little severe form and they may have little dehydration or severe fever and may need to be admitted in hospital, and most of them recover in 2 to 3 days. Very rarely, children may have little severe form wherein they may have breathlessness, pneumonia or other infections, and which may require little prolonged and advanced treatment. One more thing which is seen in children is a condition which is similar to Kawasaki's disease, which presents usually days or weeks after the initial infection. This is called as multi-system inflammatory syndrome of children, or MISC. Now, what is the difference? This presents usually late. It presents with high degree fever like 39 degrees, persists for more than 3 days, and presents with rash, conjunctivitis or redness of eyes, cracked lips and rashes. They may also have little nausea and diarrhea. But this is important because these children may have some cardiac complications. So these are the children which are to be managed in a tertiary level healthcare centers. Recently in UAE, 5 of such cases were successfully managed in Abu Dhabi Government Hospital. The other concern which we have because of this COVID-19 is parents are ignoring their little milder symptoms. They are trying to avoid coming to hospital. One way it is good, they want to avoid exposure to the virus. Some may also think that already the healthcare is under burden because of managing severe cases and they want to avoid further strain on the hospitals. I, in charge of this institute, will say thanks to them for concerning about the doctors and the hospital. But now, since things are little getting better and organized, I would suggest for parents that if they have children who are not improving or symptoms are little severe, please do come to hospital and visit doctors and get the treatment early so that the child's condition doesn't worsen. Also, another thing, many children are due for some routine vaccinations. Ignoring this also is not good because many times vaccines prevent many other diseases which may be deadlier than coronavirus. So most of the hospitals now have their changes in the infrastructure and they ensure that these patients don't come in contact with the other non-vaccination patients or other suspected coronavirus patients. So they can safely come to the hospital and continue with their vaccinations. Besides this, what we need to know is the coronavirus pandemic itself, as well as the certain measures which were taken for prevention of its spread, has resulted into some kind of impact on the child health, especially the restriction of physical activity and the social isolation that has affected the child health in physical as well as mental form. Considering the physical impact, we see children need to be active. Restriction of this physical activity, inability of the child to go out and play in the playground or garden or park has affected their daily routine. Most of the time they are sitting at home, maybe seeking entertainment from other resources like gadgets. This makes them idle and also gain more weight. Already in this part of the world, obesity and overweight is a problem and the lockdown aggravates this. Now this can be avoided easily by parents. After the school time or something, they can have a little fun-filled family activity where all are doing regular exercises. Smaller children may do just jumping, skipping or dancing. Little elder children may do push-ups, pull-ups, and if treadmill is available, little adolescents can use the treadmill. If not, or if space is limited, they can just do some aerobic exercises. Doing this together with the family gives them more of a fun-filled experience, gives a positive impact on the whole family, and keeps the depression at bay. The other concern is about the screen time. As we all know, the schools are being closed, and that's good. That has prevented the spread of infection among children. And most of the schools have changed to online teaching. This in one way has really helped the children. Because of the schooling, they can interact with their school teachers, they can interact with the school friends, and the normalcy and regularity in their life is maintained. So this technology has really helped here. Also, children can be in touch with their distant family and relatives, especially the grandparents. They can look at them, they can speak to them, and many parents and several children are concerned about the elderly. As we all know, this coronavirus affects more severely to the elderly. So looking at their grandparents, talking and smiling to them can really reassure them. So what usually is the concern is the excess of recreational screen time after the school timing. Screen, as we all know, the exposure to screen can affect children in different ways. The American Academy of Pediatrics has mentioned that less than 2 years there should be no screen time. Some toddlers may have around 1 hour, and maybe in the school age group, they have to expose to the screen. What are the effects of this exposure to screen? Its effects on the mind and the body. Mind especially, this can cause little lack of alertness, it can cause mood alterations, and most importantly, it can affect the sleeping pattern. Now this can be little controlled by the modern gadgets having some blue light filter or daylight filter, which you can put it on. This affects the blue light which comes from the screen can reduce, and this reduces the effect on the sleep pattern. But more than that, also it affects the body. See, now child is sitting in front of the TV or gaming console just for entertainment. If the position is awkward, or just sitting in front of the computer for a long time, this itself can have some back pain, headache, neck pain. So that also can be reduced by reducing this activity. Also, since the children at home looking at the gadgets from close distance and not going outdoors, that also can cause a lot of eye strain, and also some kind of short-sightedness or myopia may be seen. So this screen time has to be restricted, not only in the amount but also in the space. Like, parents should avoid any screen in the bedroom because already the sleep is affected, and with the screen exposure they can further decrease their sleep. The other thing is that reducing online activity is important, and even whatever is going on, that should be monitored and supervised. We need to take care of our children from cyber bullies or other exploitation online. So best thing for parents to do is try to engage children in other creative activities, like maybe doing some craft, drawing, painting, solving puzzles, or sometimes parents themselves can play some card games or board games with them, which can again be more of a fun-filled activity for the whole family. This continues their mind stimulation, and the learning also continues. What parents can do is that they can teach children some new skills during this lockdown period, because they both have more time at hand. They can introduce more of reading habit in them. Inculcating reading habit definitely helps in their future. Or even reading to children who are young at bedtime can help them to fall asleep easily. Other thing what parents can do is involve children in their daily household activities, like maybe cooking depending on the age, or maybe cleaning and other things. This gives them sense of belonging and sense of responsibility to children, and also will help them in the future. The other concern which parents need to attribute at this time is to the diet. See, children are sitting at home, they're getting bored, and they're just munching on junk food like sweets, chocolates or chips. So this further aggravates their health. So parents should ensure that they take balanced diet, eat proper food including fresh fruits, green leafy vegetables, and also they should see that they drink a lot of water to keep themselves hydrated, especially during this summertime. As we know, a lot of vitamins like vitamin D, vitamin C, zinc, all this helps children to boost up their immunity. So even this intake can be maintained after consultation with their doctors. Okay, besides the physical impact, the other important impact is of the mental health. Now we all know children thrive well when they have a protected and safe environment, when they have proper connections with their family and the community, and when all their basic needs are being met. Now all this has been affected by the coronavirus pandemic itself, and also by the certain measures which are taken to contain the spread of this infection. Children are not able to go out, they don't enjoy the normal activities which they do over the weekends. Even the extracurricular activities in the school have to be contained, like maybe elocution, maybe sports, maybe other activities. So that way the children are already upset. There may be some changes in the family dynamics also because of this economic downturn. The parents may have, the jobs may be affected, or the salary may be affected, and all this may have also some effect on the family as a whole. Now, different people react in different way. So it is but natural that in this scenario, in this crisis, children as well as parents may have some sense of extreme emotions like anger, frustration, confusion, just unhappiness, or sometimes they may feel lonely or helpless. Now some parents may find it very easy to change their schedule and regularize into this new routine, whereas some parents may find it difficult to adjust with the home and house duties. Even children, some may show extreme emotions like anger, may frustration, some may be just withdrawn, or some may just behave normally as if nothing has happened. So many times the children are concerned mainly about whether they will get the infection, whether they will be isolated from their family and friends, and when this thought crops in their mind, it is important that that doesn't aggravate further. Any sign or symptom of anxiety or depression in either child or in their caregiver may have some impact on them, and they may need some kind of counseling. Even some may require some kind of professional help. The basic advice I would give to the parents to take care of children is first to take care of themselves. They themselves need to be calm, composed. Only then they will be understanding what's happening in child's mind, what do they need, what they are fearing about, or what's happening for them. They can take care of children because finally children needs a lot of love, attention and caring. So that just brings me to certain tips for communication with children. See, some children come to parents themselves and ask so many doubts, so many questions. That's fine. So children, if they are asking, parents need to do one thing. They need to give them patient hearing. They need to be there with them. They need to listen to them, try to understand what's happening in their mind and give them proper advice. Reassure them. While doing this, it's important that parents themselves are calm and composed. So we know children are learning from parents. They look at the parents, how they are behaving with them, how they are behaving with each other, or how they are behaving with other friends. So from that they get cues, and if they are stable and relaxed, children also will get stable and relaxed. Okay, some children may not be that inquisitive. They have some doubts, but they are not coming out. They may be just confused or withdrawn. That time it is better for parents to ask them questions. Like if it's a young child, parent can just ask them, what do you think, what's happening around, or about this closure of schools or something. And that way we know what they're thinking. Or maybe a little elder child, we can ask them directly, like what do you know about coronavirus and about the pandemic. And this way we know what ideas they have, what concerns they have. Many times they get some information from other resources which may not be totally based on truth. Many times it are rumors or hear and say. So it's a good opportunity for the parents to clear out these things and just say the correct thing. Maybe they need to be honest with children, tell them the correct thing. But at the same time, we need to know what is the capacity of the child. Okay, don't give too much of information also in one go. Sometimes too much of information, especially the negative news coming from different sections of media, can really further depress the child. They may hear something which may frighten them and they get more worried. So better to control the resources from what they are getting the data. Better to give this information yourself. And while explaining all this, it's better that parents talk also about the positive development around. Like they should tell children that first of all, children are less affected, they have mild symptoms, and how the doctors and the hospitals are managing the children and other people, and they are recovering and coming back home. So this way definitely will reassure them. Okay. We need to also tell them, like even at highest level, people are trying to control this pandemic. Even the scientists are trying to develop new medications and vaccines to control the pandemic. This also will help them calm their minds. We also should teach children how they can take care of themselves, like more on the hygiene advice, like they need to wash hands regularly, okay? Especially they should not touch anything which are not required, and even if they touch, they should immediately wash hands. If they find any person very sick, like having cold, cough, or just appearing sick, they need to go away from that person, not to go too close. And if they themselves are sick, like they may have cold, cough, then they need to use either tissue or handkerchief, cover their nose and mouth, and again discard them nicely in the trash and then wash hands again. This is a good time for the parents to also stress on the importance of good diet, good sleep, and increased intake of water to the children. And finally, I think parents should tell children it is okay to get stressed sometimes. Everyone does. Okay, and life is not always rosy. There will be ups and downs, and sometimes these hardships do come in our life just to make us a better and stronger person. So I feel this coronavirus pandemic should be taken as an opportunity to inculcate positivity and optimism among ourselves and our children. We can teach the children about hygiene. As I told you, washing hands regularly, okay, using proper hand sanitizers. Now this sanitizers can be used in children if especially supervised by parents, especially before eating food. Only thing they should care that the amount of sanitizer to be used, and it should be rubbed properly. There is no need to wash hands after that, it gets absorbed. Okay. Even the mask. Small children up to 2 years of age may need not use mask, it may be difficult for them to handle. Even toddlers, it is little difficult for them to hold on with the mask, but parents should try. There are children masks available in the market, they can help the children with those masks. And finally, I would say parents should take care of the children themselves, as well as their own health is also important to take care of their children. Thank you.